Good morning, and thanks for waking up with us. I'm really excited about our first episode of Wake Up with Wilson. January tends to be a month where everyone sets goals for themselves. More times than not, those goals and New Year's resolutions involve self-improvement, how to lead a healthier life, or losing weight. Today we're going to sit down with lead physician and bariatric surgeon, Dr. Stephanie Dunkle-Blatter, and she's going to take us through the journey of how you or someone you know can start their journey to better health. Jump right in. Let's talk about obesity. Share some information about obesity as a disease and some stats that our viewers would be interested in.
Obesity has become an epidemic. It's a growing problem in the world. And the problem with obesity, it's really an underlying disease that causes a slew of other diseases. It's become so common, and the thing about obesity is it's a very visual disease. So you look around the world and you can see people that are overweight. Overweight often leads to being morbidly obese. And we used to think that, people were not exercising enough control, we're not exercising enough, we're eating wrong. And we've learned more and more that really obesity is a disease. And the problem is we can't pinpoint one protein in the body or one gene. There certainly is probably a genetic component to it. And there certainly is a behavior component to it, but it's not simply what we used to think is that you just eat too much. Most patients that I see honestly have tried everything to lose weight in their lives. They don't eat that poorly. They have this disease. So just like cancer that needs treatment, obesity needs treatment.
Great. Can you share some facts with our viewers about obesity throughout the country and even the world?
Yeah, I mentioned it's growing, and a good resource is the Centers for Disease Control, the CDC. They collect data every year. The latest data shows that here in Ohio, obesity rates are up to 35%. Worldwide, about 60 to 70% of us are overweight. So we define obesity when the body mass index reaches about 30. And then we define morbid obesity when somebody is about 100 pounds overweight or a body mass index of 40. One reason we like getting the word out is so that people do realize it's a disease, and there are good treatment options.
Some people at home may be asking themselves, well, I have this health condition, and they don't really know that it's due to obesity. Can you talk a little bit about some of the health conditions associated with obesity?
Yeah, excess weight really affects the body from head to toe. And we're learning more and more about obesity, and it's really the underlying disease that causes diabetes in most cases. It's 95% of type 2 diabetes is caused from being overweight. Obesity causes diabetes, it also causes heart disease, it causes sleep apnea, it even causes cancer. We're learning more and more about genetic causes of cancer, as well as genetic causes of obesity, and there definitely is a genetic link there. There's also, when somebody's overweight, there's a chronic inflammatory process that's going on in the body, and that contributes to cancer. So we see higher cancer rates of breast cancer in men and women, and part of that's because of a hormone imbalance that occurs once you're that overweight. But we also see increased colon cancers, pancreas cancer, esophageal cancer, kidney cancer, and that's pretty scary when being overweight can cause cancer. Now, some of the other diseases, high blood pressure, heart disease, sleep apnea. The good news is that if a person can lose significant weight, many of those other diseases can be cured.
Let's transition into talking about our program at Wilson Health. It's really exciting to sit down and talk about it. It's a fairly new program, but let's talk to our viewers about the journey of bariatric surgery and the weight and wellness program at Wilson Health. Can you take our viewers really through that process and what it looks like?
I'm very excited about the program we're creating. Lots of very talented people, very passionate people that are starting up this program. We're already seeing patients. We're doing seminars. Most people know what they need to do. And I've had people say, oh, no, I want to do this on my own. And I don't know why you do it on your own when you have a whole team of people, experts, who are here and ready to help. So actually, most people think about doing something about their weight for about 4 years before they actually take that first step. And what my patients have told me is once I took that first step, I knew you were there for me. It's not easy, but it's easier when you work with a team of experts. The way patients start out is they first register for a seminar. A lot of patients are referred to me to start that process, and you certainly can check in with your primary care physician and they can get you on the right track to get to us. But at a seminar, we talk about obesity and the problems that it causes, and really talk to patients about, unfortunately, what this disease is doing to their bodies. We talk about all the treatment options. There are medications. Of course, it involves a lifestyle change. What we've learned through years and years and years and years and years of trying to help people lose weight is the most effective treatment is surgery. And it's really the only proven method to sustain significant weight loss. So the surgeries that we do include, they're all laparoscopic surgeries. We do the tried and true gastric bypass, which still probably remains the best operation. We do the laparoscopic sleeve gastrectomy, and occasionally the lap band, which actually is going out of favor. One thing we do at the seminar is talk about the surgeries, all the pros and cons. Patients have a chance to ask questions. It's a free seminar. There's no strings attached. Just come learn about it.
Great.
Sometimes people come to that seminar a couple of times before they're ready to move on, and that's fine. Some people come to that seminar and they want an appointment that night. So that's kind of the first step. And then it is a journey. We talk about what kind of journey have you been on so far? What have you tried so far to lose weight? Unfortunately, when somebody's in that obese, or especially that morbidly obese category, all those diets, all those medications are unfortunately not going to get the significant weight off that patients need. And that's why we talk about surgery. And surgery really has become safer and safer as more of us are fellowship trained to do these operations. And so that can be scary. Right. So that's why we really have a whole team of people. It's not just a surgeon saying you need this operation. It's specially trained nurses. We have very caring, very talented dietitians that work with patients. We have a whole team of administrators that are behind us, supporting us, a whole office staff that, and in fact, the whole hospital really has been trained in sensitivity to help patients and support patients and not judge them for the state they're in.
Great, that's
so
great.
I love fostering that non-judgmental environment, and it's really fun.
Right.
Fun program to really help people who've really struggled their whole lives really turn around their health and honestly become happier, healthier people.
Wow, that's great. That's great to hear. We talked about the great team at Wilson Health in our weight and wellness program, and we are so fortunate to have Kelsey, our lead dietitian, join us on today's episode to talk a little bit about her role in the weight and wellness program at Wilson Health. So welcome, Kelsey.
Thank you.
How are you?
I'm good.
Good. Can you talk a little bit about your role in the weight and wellness program at Wilson?
Sure. So my role is obviously the dietitian, so I meet individually with the patients to kind of do an initial nutrition assessment of them. So I look at their previous health history, how many times they've tried to lose weight, whether it was via Weight Watchers or a medication, and also look at their current diet habits and work with them one-on-one and indicate some needs for some changes and help them along the way. And we also set little goals at the end of each session, and I see them about 3 to 6 times during this journey, depending on their requirements for the program. So we set goals with the patients, and each time that they come in, the goals get harder each time. So just identifying with them some ways for improvement, and some goals are going to be harder than others for each. Every goal plan is individualized for each patient based off their needs.
Great. And maybe both of you can talk to this a little bit, but when we're talking about obesity and we're talking about bariatric surgery, there are a lot of important components, but talk to us a little bit about the importance of nutrition through this journey. I mean, it really is life-changing if you have a candidate that goes through this process.
Right.
Yeah, I mean, we talk about the surgeries really as tools. And so once we give a patient this tool, if they don't use that tool properly, which mostly is putting the right foods at the right time in their bodies, the tool's not going to work. And everybody knows somebody that's had bariatric surgery and it didn't work, and why didn't it work? And what we're learning more is it's not the surgery, it's the support, it's the follow-up, it's the education. And so that's why programs like ours are going more and more to more support, more education. The surgery is the crucial piece that really helps people start to change, but then it's a tool that you have to learn how to use. And so the dietary part is crucial. Some people start out and think there's no way I can make all these changes, and that's why we really take steps along the way. And Kelsey is fabulous at assessing a patient. Where are you? What are your thoughts about this? Mm-hmm. And if they're really anxious or really worried, well, guess what? There's other people that can help us with that. The other thing that Kelsey's very involved in is our support groups, which are monthly.
Good to know.
And so support groups are open for the public. You don't have to be a patient. There's no cost. You don't have to sign up. You just attend our support groups, and there's always an educational piece to it, along with an environment where you can relate to others that are on a similar, but of course individualized journey.
Great. Good information. Well, as we wrap up, Kelsey, I'm going to put you on the spot here.
Okay.
With it being January and everyone setting goals for the new year, losing weight always is kind of that number one goal that people set for themselves. Any little tips that you can leave us with today as we kick off the new year to lead a healthier life from a nutrition standpoint?
My tip is going to be just to stick with it. I know it's hard to do, but you got to make small steps. And so you're likely to stick with the changes. And that's what my job is, to help them make those little changes and then turn those into bigger changes, and then to lead them to make these changes for life.
Great. Good to know.
Yeah, you really got to value the little successes.
Yes.
Some people make a lofty goal, I'm going to lose X amount of weight. And, if they haven't been perfect for 2 days, they're done.
Right.
And nobody's perfect. It takes months to change habits, sometimes years to change habits. So what we really do is try to emphasize the positive. Okay, you didn't do all this, but look what you did do. And I mean, really, she nailed it, and it's sticking to it. People always ask me, what's the best diet? I don't know what your answer is, but my answer is always the best diet is the one you can stick with.
Yes, I agree.
So, I never say, oh, do this diet or that diet. It's, it's everything in moderation, basic healthy diet, and we can do so much just with basic nutrition.
Yes.
So, I'm thrilled to have Kelsey on the team, and she does
That's
great
awesome.
work with patients.
Absolutely. Thank you both so much for joining us on our first episode of Wake Up with Wilson. We're kicking off the new year with a subject and topic that really hits home with a lot of people. So we're really excited to bring this to our community, and hopefully everyone gained some insightful information about our weight and wellness program. Thank you for joining us for our very first episode of Wake Up with Wilson. Be sure to check us out next month, where we'll be talking about how you can have a healthy heart at any age.